Okay, here we go. Going back to this slide because there was a lot on here to cover. Immature liver functions in infants limits the ability to metabolize medications. So again, that's a normal baby, but I had already mentioned that the littler ones, the smaller the infant, not the smaller, well that hurts them too, but the younger, I should say younger, the infant, the more immature their major organs will be. The aging process can alter liver and kidney function, and you will learn that throughout this pathophysiology course and pharmacology course. And those are a couple of the organs that are involved all the time in excreting medication from the body. So the aging process will decrease metabolism and excretion of the medications. Decreased circulation can negatively affect medication distribution. So anybody with heart disease, any type of heart disease at all, you've got an impaired circulation. Differences in hormones, distribution of fat and water, weight, height, and lean body mass can affect medication absorption, then the metabolism of it, the distribution of it, and of course, excretion from the body. Concurrent medications. Different medications can enhance the action that are put together, meaning it'll potentiate it or make it stronger, or it can interfere with an action of what the medication is supposed to do. And then the first pass effect, what is that? When taken orally, the meds basically have to go through the liver. And so we call that the first pass effect. If it's given another route where it doesn't have to go through the liver, meaning usually it's an IM into the muscle or IV into the vein, it may have to be given an alternate route if you've got a liver problem. And so we'll bypass that first pass effect. If you don't understand that, don't worry about it. I'm going to talk about it extensively in class. Nutritionally, presence or absence of food in the stomach can alter medication absorption. And you will also learn that in that what antibiotics have to be given with food. And other medications, a thyroid medication, they tell you do not take with food. Don't have anything for an hour because they really want that absorbed well. So it just depends on the medication. Let's see. And then pregnancy. Oh my gosh. Pregnancy, basically you can't take anything. You just can't take anything. That's what we call a contraindication because we don't want to affect the baby. And we know with the placental circulation, everything the mom takes in goes right to the baby. So there are medications you can take, but I always tell people just don't take anything until you talk to your doctor. Don't take something and then go, oh no, maybe I should have checked first. And then genetic factors. Inherited traits may have specific influence on the metabolism of medications. Psychosocial variables. Again, what does that mean? It's psychologically and socially. How do they fit in society? Are they mentally well? Health, illness, beliefs, previous experience with medications. And they're a really, really good nurse practitioner, physician, nurse, that's the intake nurse. You are the admitting nurse. We need to listen to patients because they can tell their story better than we can. Even though sometimes we think we know better than them, that's a very, very big error to make. Always listen to your patient about any of the experiences they have had. A knowledge base for the nurse, it's themselves. And nowadays, so easy with the computer, and you can even have apps on your phone to look up drugs. Just don't ever, ever, ever give a medication unless you know what it does. Take the 5 minutes, 3 minutes, 2 minutes to look it up and make sure it goes with this patient that you're taking care of. Cultural beliefs. We could have a whole class on that. The different cultures and how they feel about medications in general or specific medications. The developmental stage of the person. Is it an adult that has got cognitive problems? Then we need to go to whoever is watching over them, whoever the caregiver is. Social support, financial status, very, very important. We don't ever want to, or physician specifically doesn't want to order a medication that's going to cost $200 a pill when they're on state aid. They would not be able to afford that. Most people couldn't afford that. So we need to go to some type of a generic brand if there is one. And then potential for medication dependence and misuse. We'll be talking about that quite a bit throughout the program also, or this class, simply because we have a lot of people dependent on all kinds of medications that are not illegal. So what's happening with that? What do we have to do to be patient advocates for that? All right, administering medications. Again, always obtain all necessary objective data. So you want subjective, that what the patient's going to say, but you always want that objective data before administering medications. And these are just some examples. Apical heart rate before giving digitalis preparations. Digitalis is one of the most potent, strong heart medications there is. It can stop your heart because it slows the heart down so that it has more of a cardiac output, a punch, but it does slow the apical rate. So wouldn't that make sense that we need to know what it is? If it's at 58, do we really want to slow that heart rate down to 48 or less? I don't think so. Blood pressure, same thing. Before we give a medication that's going to lower it. Blood type of the mother and the infant before giving RhoGAM, and you can just read through those. Peak and trough levels we will talk about, but we need to know the information before we give this type of any drugs linked to any of these here. And these are just a few. The 6 rights of safe medication administration. I want you to circle this, star it, write it in red, write it on your brain. This is so, so important because if you do all 6 of these, it will at least help you from doing a med error. It's usually people who don't have time, they're in a hurry, they've got a lot of patients, they got to get to the next patient in the next room, that make these type of errors, that do not check all of these. I teach intermediate med surg, and I give the student nurses one pass on this if they forget to check one of them. After that, they have to fail my class. I feel that strongly about this. It takes really not even 2 minutes to do all of this. The right person, the right medication, the right dose, the right time, the right route, and then right documentation. If you don't document it, it wasn't given. It has to be documented in the patient's chart. We're going to check the client's identification every time a medication is given. It doesn't matter if you've been in that room 12 times. You're going to check the ID band again, the name, a photograph, or a birth record. We need 2 identifiers for that. For medication, we're going to correctly interpret the med order. We're going to read that label 3 times. When the container is selected, when we're pulling it out of the med drawer, out of the room, out of the cabinet, wherever you're pulling it from. So that's the first time. When you're taking the medication out of the container, we're going to look at it again. That's the second time. And the third time is when we're giving it to the patient. We're going to tell the patient what we're giving and why we're giving it. So 3 checks right there. The dose and time kind of speak for themselves in the documentation. Resources for medication information. The nursing drug handbooks is really all we had. There's always a drug. There are drug books all over. Acute care is the only thing I can speak for, but hospital. Now they have apps right on your phones. All you have to do is click on the app and look it up. Pharmacology tests, obviously, you guys are going to have a huge one. You probably already have a giant one for this class. Professional journals, and those are not a journal that we write in. This professional journal is one that is coming from a physician, usually, or an advanced practice nurse or PA that has written an article about specific drugs. And then the physician desk reference is the PDR, is abbreviated, is the one that every single drug is in, ever created. And it is huge. It is like, I don't know, 1.5 feet high. And then professional websites. Medication, for medications, our med class may be organized according to a pharmacologic action, like all opiates or all antibiotics. The therapeutic use, this is going to reduce inflammation, or this is going to take pain away. The chemical makeup, or if it's safe to use during pregnancy. The action mechanism, what's it going to do? Is it going to lower blood pressure? It's going to lower the heart rate? Is it going to increase the heart rate? Sometimes we want to increase that heart rate if somebody is in shock, or they're dying, or their heart is too weak to pump. Therapeutic effect It's the primary action for which the medication is administered to a specific patient. One medication may have more than one therapeutic effect. Adverse effects are undesired or sometimes a dangerous side effect. What's that all about? Toxicity has specific risks and manifestations of toxicity. For instance, liver damage can be caused from an overdose of Tylenol. Believe it or not, a lot of people don't know that. They just keep taking it for the headache. And it can actually be extremely toxic to the liver. Medication interactions, they can interact with each other, resulting in a desired or an undesired effect. Precautions and contraindications. Some medications require precaution when used with certain people. I think I've already kind of talked about that. Our little tiny people, early, young, and the very old. And the contraindications, they're the ones that are contraindicated, meaning we're not going to give it for a specific disease, condition, age, preparation, dosage, administration. We need to know any special considerations for the prep of it. Again, I kind of talked about that a little bit with the drugs that have to be refrigerated, or some that are sensitive to light, or some that have to be mixed right at the bedside because they're chemically incongruent with what we have to put them in. So we have to give it immediately or it's going to not work right. And then nursing implications, very, very important. Nurses need to know what they're giving it for. What are the effects of it? How to monitor the therapeutic effects. Is it working or is it not working? Medication errors, and we will be talking about this at length, but the wrong medication or IV fluid, incorrect dose or IV rate, the wrong client at any time, or route. Administration, if we know it's documented in the chart, in that medication administration record, that the patient is allergic to it, that's a med error, and we give it anyway. Omission of a dose, what does that mean? If we forget to give a medication, that is a med error. Incorrect discontinuation of a medication, or we take an IV out, wasn't supposed to be taken out, that's a med error. And then self-administration of meds typically takes place in the home or community-based settings. Careful reassessment if necessary or is necessary to determine the client's suitability for safe self-medication. If they can't safely administer it to themselves, we really need to get home health involved in it and teach somebody else in the family if the patient can't, or somebody that needs to help this patient. We're going to always give the client instructions for each medication, written and verbal, regarding everything about the medication, and make sure we've got scheduled follow-up visits with the primary care provider. So do we need to draw their blood? We need to see how it's affecting them. Okay, folks, that's all for this medication administration. We will be talking a lot about a lot of this as we go throughout this class, and I've got a fairly large PowerPoint to get through on the first day of class. Hopefully we will, if not the second. All right, until next time, I'll see you then. Bye-bye.